Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College. And today, I will be performing my written demonstration in assessing the abdomen of the patients. This assessment is also important because the physical examination of the abdomen is the key step in the evaluation of any abdominal complaints such as pain, distension, enlarged organs, masses, and etc. This assessment is of course composed of 4 parts. The first one is the pre-introductory phase, followed by the introductory phase, and followed by the working phase, and lastly, followed by the summary and closing phase. Now, let us proceed in the pre-introductory phase. Of course, first we need to review the client's previous medical records and the doctor's order sheet if available, and we need to determine the scope of the assessments needed. So I have here the doctor's sheets. So it was aforementioned here that I will be having an assessment of the abdomen for my patients today. And also it was said here that my patient today is currently experiencing an acute abdominal pain. So after verifying the need in performing the assessments, we will be preparing the necessary equipment for this assessment. And these materials are of course, number 1, tape measure. Next, we will be having ruler and a marker. And of course, we should have a broken tips applicator, this cotton band. For example, this is for testing the hypersensitivity test for the patients. The next one is, of course, we must have this stethoscope for the auscultation of the abdomen. Next one is completeness and organization of our equipment ensures our efficiency as nurses. After that, we will be performing hand washing and use Dawn gloves if necessary for us to deter the spread of microorganisms. Now, let us proceed in the introductory phase. First, we need to greet the clients politely and the client's companion if around, and introduce ourselves and verify the client's identity, and ask how the client would like to be called during the assessment, and also establish rapport with the clients. This procedure is important because it connects you to your patients and can improve patients' care. Good day, sir. My name is Kenneth D. Velasquez, your student nurse from Davao Doctors College, and I am assigned to assess your abdomen today. So before we start, may I see your wristband, sir? Can you please tell me your full name, sir? How about your birth date? Thank you for that, sir. So, how would you like me to call you? Okay, so Sir Miles, how's your day going so far? That would be nice to hear, sir, and I really hope that our day will end up a good one. And from this, we need to explain the procedure to the clients and how he can participate during the assessments, and also provide the clients the opportunity to clarify, ask, or raise any concern. Explaining the procedure to the clients can help reduce anxiety and enhances cooperation. So, Sir Miles, again, I will be performing your assessments in the abdomen. And of course, I will be inspecting your abdomen, auscultating, percussing, and palpating so that I can assess normal findings from abnormal findings, sir. So that I can also teach you further teachings about that one. And also, sir, it was aforementioned here that you are currently experiencing acute abdominal pain. Can you please tell me, sir, where do you feel the pain? I see. So from the scale of 1 to 10, 1 is the lowest and 10 is the highest. Okay, so it was my patient must aforementioned that he is experiencing acute abdominal pain in his left lower quadrant. So in this manner, we will be examining that part always last. And also, sir, may I ask, do you feel like you're nauseating? No. And also, sir, do you find it hard to urinate? How about diarrhea, sir? Do you experience that one? And how about your bowel movement, sir? Is it okay? And also, sir, do you feel any issues in your abdomen? Any histories? And also, sir, how well do you exercise?
I'm doing great in exercise.
I see. That would be nice to hear, sir. And before we start, sir, do you have any other questions so far? I see. Okay, so it is very important to know any health history to gather a subjective data from the patient so that the healthcare team will promote health and minimize chronic conditions. And next, we will be ensuring the client's comfort, privacy, and confidentiality. We also need to make sure that the assessment setting is assured to be safe secured, and free from distractions. And also position the client to be seated comfortably. But if you have female patients, drape the anterior thorax when it is not being examined. Privacy is important because it involves protecting the patient's integrity. So, sir, I'm just closing the door, sir, for you, okay? Because your abdomen will be exposed in the assessment. And also, sir, I'm ensuring the curtains here. And is the temperature okay? Okay, so is it okay, sir, if you sit down so that we can proceed in the next assessment? So, lastly, we will be ensuring that the client has emptied his or her bladder to make the assessments more comfortable for the patients. So, do you want to be in the CR, sir, before we start the assessments? Okay, sir, so this way to the CR. I'm just going to lock this door, sir, okay? And of course, while waiting for the patients, we are now in the inspection part or in the working phase. So, in surveying the abdomen, of course, we need to position the client in a supine position, head on pillow or raised knees, flex or on a pillow and arms at the side. Sir Miles, are you done? Okay, sir. You can now go back here. I'm just going to assist you now because we will be starting. Yeah. And next, we need to cover the upper and lower body parts off with a bed sheet, leaving the abdomen exposed so that the abdomen will be fully visible during the assessment. Okay, sir. So first, of course, I'm going to bring this one under your knees. Just and of course, sir, I'm covering your area here. And you can just bring this down here. And I'm now exposing your abdomen, sir, okay? Just. How is the temperature, sir? Okay, so now let us observe the abdominal skin. First, we must note for any vascularities or visible dilated veins like a spider vein. So as you can see here, there is no any vascularities found in the abdomen of our patients. Next, note for any striae or stretch marks. And as I can also see here, there are no stretch marks found on the patient's abdomen. Next, assess for scars, lesions, and rashes. So as I can also see here, his skin color is normal and there are no any scars, any redness, or lesions to be assessed. Lastly, note the history of scars and document its location by the quadrants or reference lines. So if you will be noting for a redness here or a scar, you should document that one in the left upper quadrant and of course in the quadrant lines. And now, let us inspect the umbilicus for its color, contour, and location. Let us identify if it's inverted, flat, or everted. So, the location of his umbilicus is aligned in the belly button area, and his umbilicus also is it's everted, which is normal. And also, it's okay. The color is a skin color also. There is no any blue color or nauseated something. So the abnormal findings for the umbilicus are, of course, it is sunken, enlarged, and bluish in color, which are not present in the patient. So since we are done surveying the abdomen, let us now examine the abdomen. Here we will be following the IAPP, which means I for inspection, A for auscultation, followed by P for percussion, and lastly P for palpation. Of course, we will be starting with inspection. So first, we will be inspecting the contour, or if it is round, flat, or distended. So while the client lies flat or supine on the bed, look across the abdomen at a level slightly higher than the client's abdomen. So as I can see here, the abdomen of the patient is flat, which is a sign of normalities. So again, the contour again normally ranges from flat to rounded, and abnormalities include like protuberance or scaphoid and bulges in the flank area. Next, we will be inspecting the abdominal girth of the patients. We need to inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargements. This is used to diagnose buildup of fluid in the abdomen that is caused by heart failure. So, as I can see here, there are no any bulges in the flank or the abdominal girth of the patient, so which is a sign of normalities. And of course, the next procedure is that we will be measuring the abdominal girth using a tape measure at the same time of the day, ideally in the morning. So first, we need to ensure again that the client has emptied his or her bladder. Okay, sir, so before we measure your abdominal girth, I want to ask her if do you want to pee again in the CR? Okay, sir, so you can just go back here. Okay, sir, just leave the top sheet and then go back to the CR. Just open the door, sir, if you want. Okay. So the next, we need to position the clients in a standing or in a supine position, and the client's head may be slightly elevated for ortho neck patients. And hello, Sir Miles, are you done? Okay. So I just want you to stand here, sir. Okay, so that I can measure your abdominal girth. And is it okay, sir, if you just drape this one here? Hold this one. Hold this one, sir, for me. And just like that. If you're not comfortable, sir, you can just lie down. Just hold this one, sir. And of course, use a disposable, easily clean tape measure and place this one behind the clients and measure starting on the umbilicus and record the distance on this designated units like in centimeter and inches. Okay, sir, so I'm measuring your abdominal girth, and so we will be starting in your belly button area. And of course, we need to measure this one in centimeters. I just have to measure this one, sir. And also, take note that if there are distension noted, take all future measurements from the same location. So now we need to mark the abdomen with a ballpoint pen to aid in measuring the site and ask the client not to wash the mark until it is not longer needed. So sir, I have marked this one here. So just leave this one, sir, because this is washable. And you can now slide ahead down in a supine position again. Are you feeling comfortable, sir? Just a minute, sir. And let us cover again this part. And I'm just going to expose again your abdomen area, sir, okay? So again, the purpose of determining waist girth is to gain a measure of the amounts of abdominal fat which has been linked to an increased risk of coronary heart disease and diabetes. And you can refer your findings in the table above for risk ratings. So now we will be checking for the symmetry of the abdomen. We need to ask the client to raise his or her head to further assess for herniation or diastasis like bulges. Okay, sir, so is it okay if you face down there? So as I can see, there are no any herniation or bulges noted in his abdomen. So after that, inspect the abdominal movements when the client breathes and observe for peristaltic waves. This procedure is important for us to identify if the patient has abnormalities like intestinal obstruction. Okay, sir, so I'm just inspecting any peristaltic waves, sir, okay? So can you please inhale, sir? Exhale, sir. Can you please inhale again and exhale, please? Thank you for that, sir. So as I have inspected, of course, there are no bulges, masses, or hernia, so the symmetry of the patient is normal. And I did not observe any peristaltic waves, but normally, it may be seen in thin persons. After inspection, we will be proceeding in auscultation. So first, we will be auscultating for vowel sounds. Auscultation comes after inspection and before palpation because palpating prior to auscultation might distort the quality of vowel sounds. So of course now, use the diaphragm of the stethoscope and make sure that it is warm before placing it on the abdomen. Warming both our hands and the diaphragm before application will be helpful for the assessment, particular in ticklish patients. So of course first, we will be sanitizing our stethoscope. With dry trash can, and then wet, and then lastly with a dry. So of course we need to warm this one, and you can start wearing this one. And next, we need to apply light pressure or simple rest the stethoscope if the abdomen is tender or painful. So since my patient aforementioned that he experiencing pain in the left lower quadrant, so we will be auscultating this one last. And of course, next perform auscultation starting with the right lower quadrant, then clockwise, and listen to each quadrant for 1 minute to confirm any absence of vowel sounds and notes for the intensity, pitch, and frequency of the sound. Okay, sir, so I'm going to start auscultating using the diaphragm, sir, okay? And I am hearing for the vowel sounds here. And normally, the vowel sounds are clicking 5 to 34 times per minute. Next, in the right upper quadrant. After 1 minute, left upper quadrant. And lastly, after 1 minute, left lower quadrant, but be sensitive in this part because the patient is experiencing acute pain. Then after 1 minute. So of course, normally vowel sounds are high pitch, gurgling, and 5 to 34 times per minute. But if vowel sounds are absent, listen again for 5 minutes before deciding a complete silent abdominal surgery. And now we will be auscultating for vascular sounds. Now, this time, we will be using the bell of the stethoscope to listen for Bluey, heard over the abdominal aorta, renal, iliac, and femoral arteries. So, first we must locate the aorta, the renal, the iliac, and the femoral arteries. So, of course, using the bell of the stethoscope, the aorta, usually, you will be hearing aortic pulsations here. Then the renal. This is the left. And the right. And then, let's proceed in the iliac arteries. It is upper in the umbilicus part. And then here, in the left iliac artery. And of course, also assess in the femoral artery. Okay, so there are no bruit heard, which is normal. And next, we'll be auscultating for the venous hum and use the bell again of the stethoscope to listen for venous hum in the epigastric and umbilical areas. So let's locate again. The epigastric area is here, and then the umbilical areas is here. So let's auscultate again using the bell. Okay, so of course, the presence of an abdominal venous hum is virtually diagnostic of portal vein hypertension. Next, we will be auscultating for friction rub over the liver and spleen by placing the diaphragm of the stethoscope over the right and left lower rib cage and listen for the friction rub. The spleen is located in the 6 to 8 intercostal spaces, and the liver is located in the 6 to 12 intercostal spaces. So left lower and then right lower rib cage. So let's start. And so also use the diaphragm here. Let's start auscultating the spleen part. Hello Sir Miles. So I'm auscultating now your spleen and liver, okay? So I'm asking you to breathe, sir, okay? Inhale and exhale, okay? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, sir, so here, I want you to inhale again, sir, please. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. So a friction rub over the liver is an indicative of cancer in the liver with inflammatory changes or infection in or adjacent to the liver. It is also important to trace proximally the audibility of an arterial sound to determine the exact anatomic site of the flow disturbance. So after the auscultation, let's proceed in the percussion parts. So with the percussion hand technique, lightly and systematically percuss all quadrants. Percussion may proceed clockwise or up and down over the abdomen. So now we need to percuss several areas in each of the 4 quadrants to determine the presence of tympani and dullness. So that's several areas in each quadrant composed of 13 specific areas. So in the right lower quadrant, or the RLQ, we will be having 1, 2, 3 areas. In the upper right quadrant, there would be like 4 areas, 1, 2, 3, 4. And then in the left upper quadrant, there will be 3 areas, which is 1, 2, 3. And in the left lower quadrant, which is the tender part of the patient, we will be having 1, 2, 3. So let's start using the middle finger of your left hand. Put this one here. I'm gonna start percussing, sir, okay? And then use the another middle finger. So there are tympanic sounds. This one here is dull. Let's proceed here. And then in the left lower quadrant, which is the last part, because this is very sensitive for the patient because it's tender. And you also need to look at the facial expression of the patient if he is experiencing pain when you are percussing. Okay, so the findings for that procedure is that you will be noting tympani over the gas-filled area and dullness over the fluid-filled tissue. The next procedure is that we need to percuss the span or height of the liver by determining its lower and upper border, and determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, the upwards, and note the change from tympani to dullness. The purpose of liver percussion is to measure the liver size. Okay, so let's locate the parts. This is the mid-clavicular line. It is called mid-clavicular. It is the middle of the clavicular, and then this one here line. And we will be start percussing from the right lower quadrant, and we will be noticing tympanic sounds to dullness. So here. And the next one, we need to mark the area of dullness, and this is called the liver border of dullness. So as you can see here, I have marked, this is the lower border of liver dullness. I'm going to mark this one. So next is is after that, we will be assessing for the descent of the liver by locating the liver border of dullness below the costal margin, and deep inspiration asking the client to hold his or her breath. Okay, sir. Sir Miles, I'm assessing the liver descent, sir. Okay. So is it okay, sir, if you breathe and then hold that breathe for a while for me, please? Hold breathe, sir. Just wait a minute. Just going. Okay, so the liver descent is normally 2 to 3 centimeter, and for abnormal findings, it may indicate hepatomegaly or cirrhosis. Next, we will be percussing the upper border of the liver by locating the upper right chest at the mid-clavicular line and percuss downward and mark the point of the liver dullness. So this time, we'll be starting here, also the right upper border of the chest in the mid-clavicular line. I'm starting again, sir, okay? Going to mark this one. Okay, so when you have noted the upper border of liver dullness, measure the distance between the two marks, also known as the liver span. So I'm going to measure this one in centimeters. Okay, so the normal measurement of the liver span is between 6 to 12 centimeter in the right mid-clavicular line. And as you can see, I have measured 11 centimeter of the liver of the patient. And after that, repeat the percussion of the liver at the mid-sternal line. So we have assessed in the mid-clavicular line. Now we will be assessing in the mid-sternal line of the patient. Same procedure, percuss, and measure. Let's mark the dull area. Let's proceed to the upper border of liver dullness. Then let's mark this one again. And then measure in centimeters. It's 7 centimeters, which is normal. So the normal measurement of the liver span in the mid-sternal line is between 4 to 8 centimeter. And of course, after that, we'll be percussing the spleen and begin percussion on the posterior to the left mid-axillary line, or the MAL, and percuss downward and note the change from lung resonance to splenic dullness. So now I'm going to, hello Sir Miles, now I'm going to percuss your spleen, sir, okay? So I'm starting here. Hello, Sir Miles, are you feeling comfortable? Do you feel any pain here in the part, since this is your tender area? So the sound in the spleen is tympanic. And next is perform a second method of percussion, having the client to take a deep breath and start percussing on the last left interspace at the anterior axillary line. So when we say axillary line, it is here. And we will be percussing this one again. And hello Sir Miles, is it okay if you take a deep breath and hold that one for me, please? Take a deep breath, sir. Inhale, then hold that one. Exhale, sir. Sir Miles, exhale. Inhale. Okay, so Tiffany Hurd suggests that the spleen is not enlarged, and that procedure helps us to determine spleen enlargement if there are any. So as you can see here, there are no any dullness sounds because the spleen of our patient is not enlarged. Next, we will be having a blunt percussion on the liver. And first, we need to ask the client to sit facing from you. Okay, sir, so this time you will be sitting, sir, for the procedure, okay? So I'm going to assist you. And is it okay, sir, if you relocate your sitting position here? And what I want you to do, sir, is to drape this one and then just stretch your back like this, sir. Do not slouch. Like that one. And just bring your feet here, sir. Okay, so this is the blunt percussion. We need to place our left hand fist against the lower right anterior rib cage and use the ulnar side of our right fist and strike the left hand. This procedure is important so that we can note for any tenderness present upon for percussion. This is the blunt percussion on your liver, sir. Okay, is it okay if you bring this one here? Left hand and then right ulnar. And then you're just going to like blunt it, punch it this one so that we can assess any tenderness and ask the client if he will be feeling any pain when you blunt that one. I'm just going to just say, sir, if you feel any tenderness, okay? So after that blunt percussion, next assess for another blunt percussion on the kidneys at his back and place your left hand on the costovertebral ankles and repeat the steps for blunt percussion at the other side. Okay, sir, so right now I'm asking you to forward your body here, sir, okay? No, sir, just sit, sir. Then just forward your body here if you like. That one, sir. I'm going to do a blunt percussion on your kidneys at the back. Same procedure, sir. Please tell me if you feel any pain, okay? Now let's assess the blunt percussion on his left area. Just do not slouch, sir, please. Thank you. Do you feel any pain? Do you feel any pain, sir? No? Okay. So to document that one. So the next part is that we will be testing for abdominal distension, bulging, flanks, and ascites. Also, of course, first percuss the flanks upward toward the umbilicus and assist the client to turn onto the side and note change from dullness to tympany and mark these points. Okay, sir, so I'm asking you to lean this one again and just going to adjust this one. We are assessing for any bulges from the flanks to the umbilicus area. Okay, let's start. Dullness to tympany. Okay, so also we need to percuss the abdomen from the bed upward and mark the level where the dullness changed to tympany. Okay, so this is also the other shifting dullness test. It assess the same tympanic location. Let's assess another one. Same. Okay, same. So the shifting donut test appears to be negative because it has the same location of tympani. Next, let us perform the fluid wave test, and this is another test for ascites. First, ask the client to place the ulnar side of his or her hand and the lateral side of the forearm firmly along the midline of the abdomen, and firmly place the palmar surface of the fingers and your hand against one side of the client's abdomen. This is the fluid wave test. Hello, Sir Miles. We are assessing now the fluid wave test to you, sir. Okay. So what I want you to do, sir, is just you place your hand, your left hand, sir, like this in your umbilical area, in your belly button, like that. I'm just going to test for fluid wave test, sir. You're just going to like put it deeply because I'm going to assess for any fluid like when I touch this one. So let's start. Okay, so the fluid wave test appears to be negative, which is normal. So again, the fluid wave test appears to be negative because I was unable to feel the wave being transmitted across the body, knowing that he is using his hand to make sure that the wave doesn't accidentally get passed through soft tissues. So after that, we will be proceeding in the palpation parts. In palpation, of course, let us begin with light and deep palpation. So first, we need to position the client back in a supine position. And as you can see, he is already in a supine position. Of course, cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. So as you can also see, the patient's gown is draped here, and there is the top sheet, leaving the abdomen exposed. And next, begin palpating on a non-center abdominal quadrant by using the palmar surface of the fingers to compress quadrants to a depth of 1 centimeter in a tipping motion. So, as I have examined a while ago, of course, I have palpated the left lower quadrant last because my patient feel tenderness in this part. So, of course, we will be palpating this one first. And when you are palpating, of course, please make sure to watch the patient's face for his facial expression for the tenderness. And next, lift your fingers gently and proceed to the next quadrant. This is the right upper quadrant. The left upper quadrant. This is 1 centimeter. And then the tender part of the patient, which is the left lower quadrant. See, okay. So there are no consistent tension and patient has relaxed abdomen. Next, we will be using deep palpation for all the quadrants to delineate organs by using the palmar surface of the fingers to compress quadrants to a maximum depth of 5 to 6 centimeters. And of course, we will be starting in the right lower quadrant and in a 5 to 6 centimeters deep. This is to delineate organs, deep organs. And now, let's proceed to the right upper quadrant, and we are noting here for any resistance or any deeper structures. And after that, this is 5 to 6 centimeter. Then, the tender part of the patient. Okay. Next is performed by manual palpation if resistance or deeper structures is felt. So when we say by manual palpation, we will be using both our hands upon palpating deeper structures and resistance. So when we say by manual palpation, of course, we are also delineating deep organs here, but with the left above the right. And just like this, palpate from the first quadrant, deep, and next, the right upper and continuously, but also be sensitive in the tender part. Next, we'll be palpating for masses by using our fingertips to compress all quadrants to a depth of 1 centimeter in a dipping motion and note for any masses. So this time, we will be noting for any masses. 1 centimeter again. So as I have observed, there are no masses noted in the patient, which is normal. But if you will be noting masses, of course, masses can be documented with its size in centimeters. So if you will be documenting a masses, if any, of course, use a ruler and centimeter and just like that, measure that one and document that one in your sheet. And next, of course, the location. Please also take note, for example, here, the mass here. Its location is above the liver, so take note of that one and document that one also. Of course, document the mass by its shape, if any. For example, the mass is like circular or bulge-like, document that one. Of course, the consistency of the mass. For example, if it is tender or if it is in this location or quadrant, that is the consistency, and you need to document that one. Of course, you need to document the demarcation of the mass, and this also means that we should document like the boundary of that specific mass. Like for example, here in the tender part of the patient, document the mass in the left lower quadrant because that is its boundary. And of course, document for the pulsatility or pulsation, and this could be done by assessing any mass in the abdominal aorta of the patient here in the central part. And of course, note for tenderness. Also, make sure to ask the client if that specific mass affects the pain of the patient. And of course, the mobility of the mass. There are cases that a mass can be moved easily and widely because it may be from a tumor with a stalk wandering kidney or spleen. So next, we will be palpating for the umbilicus and its surrounding, and note for any swelling, bulges, and masses. This is the umbilicus area. The umbilicus is again everted, and there are no any masses or bulges in the umbilicus, which is normal. After, we will be palpating the aorta by using our thumb and first finger, or use both hands to palpate deeply and assess for pulsations. So it is normal to palpate or to feel or to note aortic pulsations. Are you comfortable, sir? So aorta, again, is the main artery that carries blood from your heart to the rest of your body. So it is normal again to feel blood pumping through this large artery from time to time. Next, we will be palpating for the liver by standing at the client's right side and by placing our left hand under the client's back at the level of 11th and the 12th ribs. So our left hand and the posterior right part of the patient, and then locate the ribs, and the last one, the 12th and the 11th. I have located that one. This is the liver part. Then, now, lay your right hand parallel to the right costal margin, having our fingertips pointing toward the client's head. Just like this. And of course, ask the client to inhale, then compress upward, then inward with fingers, and not for consistency, but and tenderness. So, sir, is it okay if you inhale? Inhale, sir, deeply. Inhale, exhale. Inhale, sir. Exhale. Okay, so do you feel any pain? So, normal liver edge, if palpable, is soft, sharp, regular, and smooth. So the second type of palpating the liver is the hooking technique by standing to the right of the client's chest and curling the fingers of both hands over the edge of the right costal margin. So when we say a hooking technique, of course, stand at the right side of the client and then place your two hands in the lower costal margin, and then of course next ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers, and also note for consistency and tenderness. Okay, sir, so is it okay if you inhale? This is the hooking technique. Exhale. Inhale again, sir, then hold. Okay. Okay. Okay, thank you, sir. So there is no tenderness with my patients, but if there is, it will suggest inflammation. So next is to test for the cholecystitis, or to test for the Murphy sign by pressing the fingertips under the liver border at the right costal margin and ask the patient to inhale deeply and note for the right upper quadrant pain and tenderness. So in this, the Murphy sign, we are like palpating the gallbladder in the liver of the patient. So Sir Miles, is it okay if you inhale again deeply and then hold? Do you feel any pain, sir? Or then no? Inhale, sir. Exhale. Okay, thank you, sir. So Murphy sign is elicited in patients with acute cholecystitis, and if pain occurs on inspiration, when the inflamed gallbladder comes into contact with our hand, Murphy sign is positive. But patient Miles is negative from Murphy sign, which is normal. So next, there are two ways in palpating the spleen. The first method is like this. Again, stand at the client's right side and reach over the abdomen with the left arm and place the left hand under the posterior lower ribs and pull up gently. This is the posterior lower ribs, and then I will be pulling up gently, sir. This is the side tying position, or okay. Then place the right hand below the left costal margin with the fingers pointing toward the client's head, and ask the client to inhale and press inward and upward while providing support with the other hand. Sir, inhale. Exhale. Inhale, sir, then hold. And also, you need to note for consistency and centerness. So, do you feel any pain, sir? No? Okay, that's good. And, okay, sir, thank you. So, that is the first method. The second method goes like this. First, ask the client to turn onto his right side. Then, palpate the spleen by moving it downward and forward. Then, document the side in centimeters below the left costal margin and note for consistency and tenderness. Okay, sir. Can you please turn onto the right side, please? Just put your hands here, sir. And of course, we will be palpating the left costal margin down and then upward. And then we need to document that one by marking with a pen. Do you feel any pain, sir? So, also, once you mark that one, you need to document it. Or measure it first before documenting it. So, it is 11 centimeters, sir. Your spleen is normal, sir, okay? So, just lie back down. So, again, I have assessed 11 centimeters of the spleen for the patient or patient Miles, which is a normal finding. Next, we will be palpating the kidneys by placing our left hand on the right posterior flank and provide support. So this is my left hand and this is the right posterior flank of the patient. Provide support here. And then, place the right hand on the right upper quadrant just below the costal margin at the mid-clavicular line and ask the client to exhale and hold the breath, briefly. Okay, sir, so is it okay if you inhale for me, please? Exhale. Inhale. Exhale. Okay, so here, gradually release the pressure of your right hand and repeat the step for the left kidney. So, gradually release, and we will be repeating the step here by putting our right hand to the left flank of the patient. Then repeat. Inhale, sir, please. Then exhale. Inhale. Exhale. Okay, so I have noted that it is not palpable, which can be normal, but it can also be palpable, especially to thin, well, and relaxed women. Next, we will be performing the hypersensitivity test to assess if the patient is sensitive to pain or has exaggerated skin reaction. Of course, you need to stroke the abdomen with a sharp object and quickly let go and repeat this step several times along the abdominal wall. Okay, Sir Miles, I'm now testing the hypersensitivity test by using this cotton buds here, the pointed one, okay? Do you feel any pain, sir? So, as you can see, hypersensitivity test can be positive if like you stroke that one and then there is redness there, then the patient has a hypersensitivity. But as you can see here, there are no any skin reactions as I have stroked the cotton tips. Okay. Next is we need to test for the SOA sign, which can be seen in some patients with appendicitis. Of course, first ask the client to lie on the left side. And of course, sir, please lie on the left side. And this time, sir, we will be exposing your leg area, sir, okay? Just straight this one. Just like that, sir. And of course, hyperextend the right leg of the client and notes for pain and reaction of the client. Okay, sir. I'm extending this one, sir, okay? Just say a word, sir, if you feel any pain. I'm starting it now. So as you can see here, my patient is negative from the SOA sign, which is normal because he did not feel any pain. But if you encounter patient having pain, this is associated with the irritation of the iliopsoas muscle due to appendicitis. Okay, sir, you can just go back now. So next is to test for the Obturator Sign. This is an indicator of irritation to Obturator internus muscle. Of course, first to hold and support the client's right knee and ankle. Okay, sir, I'm exposing your legs again. And then what I want to do, sir, is that I'm going to flap this one, okay? And the same procedure, just flex this one. And the same procedure, sir, please say a word if you feel any pain, sir, okay? And then the next one, flex the hip and knee and rotate the leg internally and externally. And note for pain and reaction of the client. So when we say externally, like this, but please make sure to and internally and note for any reaction from our patients. Okay, so as you can see, my patient is negative from the Obturator sign, which is normal because he did not feel any pain. But patients with appendicitis, the test will be extremely painful for them. Lastly, of course, we will be testing for the appendicitis. So a positive rebound tenderness is a sign for appendicitis. First, palpate deeply at 90 degrees into the abdomen away from the painful or tender area and suddenly release the pressure. And after that, listen and watch the client's expression of pain. And of course, sir, I'm going this one. And also, you also need to ask the clients which hurt more, and it is from pressing in or releasing. And also ask the client for the pain in the abdomen upward. Okay, sir. I'm going to test the rebound tenderness, sir. This is the last part of the palpation, okay? So, what I want you to do, sir, is that, can you please tell me if you feel any pain when I press it in or when I exerted the force away, sir, okay? Do you feel any pain? How about this one, sir? Yes or no? Does the pain comes from when I press it or when I let go? Press, okay? So as you can see, my patient said that it was painful when I press in the left lower quadrant. It is because this is the tender part, but the patient is negative from the rebound tenderness. It is because the pain doesn't come from when I have pulled out my hand. And of course, that is the last part. And we are now in the summary and closing phase. So first, help the client to put back his clothes on and position the client comfortable on the bed. So sir, we are done in our assessment for today. So now I will be putting back your clothes here. Okay. And are you comfortable, sir? Thank you, sir. And I'm just going to just wait a second. Okay. So next, we need to summarize the information obtained during the working phase and discuss it to the client, including the possible plans to resolve health concern, also assess for the client's understanding of the plan and the need for further teaching, and provide the client the opportunity to raise any concern. So now, sir, I have your findings here. Normal, all normals, but one tenderness. Of course, your abdomen, sir, is protuberant with active bowel sounds. Your bowel sound, sir, is normally 5 to 34 clicks per minute. It is soft. But then again, sir, you have a tender part here in your which cause the pain in your abdomen, and there are also no masses or bulges, sir, which is good. And your liver span, sir, as you can remember here, it is 11 centimeter, which is also normal in the mid-clavicular line, and also in your mid-sternal line, sir, you have 7 centimeter, which is also normal. And of course, sir, your spleen and kidneys are not palpable, which is also normal. And there are no costa vertebral tenderness that I have because palpated. So what I want you to do, sir, is that since you are experiencing an acute abdominal pain here in your left lower quadrant, of course, sir, what I can suggest so that this abdominal pain will not be felt in the future, do not overeat, sir, because it can affect your digestion here. And also drink lots of fluids, sir, okay? And also wash your hands before eating because it can spread the microorganisms, sir. And of course, sir, do not eat before bedtime, sir, okay? And lastly, sir, for your abdominal pain, lots of sleep for the body will help, sir. And for the remedy, of course, you can just like a heat compressor or warm compress for the abdominal pain. So this is the last part, sir. Do you have any other questions? And now thank the clients and end the interview politely and then aftercare and perform hand washing for us to deter the spread of microorganisms. Sir Miles, thank you very much for today, and I will be replenishing the here. Do you want to drink some water, sir? Okay. So lastly, we need to document the findings in the client's record using printed or electronic forms supplemented by the narrative notes when appropriate. So as you can see, I have documented all the findings here, including the remedies for the patient's abdominal pain. So that is the end of my return demonstration. Thank you very much for watching.